Good evening and welcome once again to another episode of It's My Turn Now, where everyone gets an opportunity to share your thoughts, share your expressions, to comment uh, with our guest speakers. And we are so excited for our speakers on tonight. We have a very skilled panel of therapists and counselors who are here to discuss mental health. This is Mental Health Month. Being a therapist, I could not allow this month to go by without me addressing it. So we're going to start off with Dr. Elect Starr. Dr. Starr, welcome to It's My Turn Now.
Thank you. It's good to be here.
All right. We're going to give you about 60 seconds. Tell us a little bit about yourself.
Absolutely. I'm Dr. Elect Starr. I'm a licensed mental health therapist, and I'm a wellness coach as well. My company is Unlimited Possibilities, LLC, and I'm a private practice mental health services. So I'm just honored to be here to share some information about mental health and self-care. So thank you for allowing me to be here this evening.
All right. Thank you very much. Next, we have Sister Leah. Leah, I'm going to have to, you're going to have to give me that last name. And I guess we're having a little difficulty getting you on here. I don't know if it's, hold on just a second. Leah, can you hear me?
Yes, I can hear you.
I can hear you, but for some reason we're not seeing. So let's wait a few minutes. Hopefully we'll get you on here. We'll see what happens. I don't know. Sometimes with modern technology, sometimes it works, sometimes it does. We'll see. We'll see. It happens every once in a while. We can't see you. And let me try. Let's try to get Christina on here, and then we'll come back to you. See if we have a problem with bringing Christina on here. So we're having problems with both of them. Okay, we have Christina. Christina, welcome to It's My Turn Now. Okay, let's go back to Leah. Leah, welcome to It's My Turn Now.
Thank you. Can you see me okay?
We can see you and we can hear you.
Awesome.
Tell us a little bit about yourself.
Awesome. My name's Leah Narenda, and I'm a school-based therapist. I've been doing it for about 8 years now, and just love working with children and love what I do.
Very good. Very good. And we're going to hear from you a little bit later.
Okay.
Let's see. I'm trying to get Christine. Let's see if we can get her back on again.
There she goes.
There you are, Christina. Welcome to It's My Turn Now.
Hello, it is my turn now. Can't see myself, but you all can hear me?
Yes.
Yep.
You can't see us?
No, it's a little frozen, but if you all can hear me, then keep going. I am Christina Walton. I have my bachelor's right now in social work, and I'm currently in my master's of social work program. I have been in the field for 5 years now, and mental health is just something I'm passionate about and love educating and talking with people about mental health and bringing awareness within, young people and just our community in general. So thank you.
Okay, very good. For some reason, we're not coming live on Facebook, so we'll hopefully they'll work later on. We're glad for you all that are on here. What we're going to do a little bit different on tonight is we're going to start off. We're going to have Dr. Starr. She has a presentation that she's going to do. We're going to give her a few minutes, and then we're going to open up for questions. So this time, Dr. Starr, we're going to bring you on.
Good evening, good evening, good evening. I'm just honored to be here today and excited to share information about mental health and self-care. And so I'm going to start off just by giving you an idea of what this presentation is all about. We're going to give some background information about myself. I'm going to highlight some mental health reports. I'm going to focus on those prevalent mental health disorders from that report. I'm going to define self-care and share benefits of self-care. And then I'm going to identify simple self-care strategies and conclude with final remarks and resources that I think will be very helpful. So just to give you a little background information about myself, I'm a licensed mental health counselor and a health and wellness consultant. My private practice is Unlimited Possibilities, LLC. And if you're wanting more information about my practice, you can go to my website, www.unlimitedpossibilitiesllc.com, and there you will find detailed information. But for tonight, I just wanted to give you a little information about who I am, what I do. My education and training includes a doctor of ministry in pastoral care and counseling. And I have specialized training in EMDR, which is eye movement desensitization reprocessing. I use that primarily for my clients who have an extensive history of trauma, childhood trauma. I also have specialized training in play therapy, grief and loss, pastoral care and counseling. And my certifications include child and adolescent trauma professional, compassion fatigue, and clinical anxiety treatment professional. I have 12 years plus years of mental health experience, along with life experiences. And some of my background training in mental health has been as a youth counselor for male and female adolescents at a residential facility. I worked as a home-based and an outpatient therapist, providing services for court-ordered families. I also provided group therapy and outpatient therapy for former male and female inmates. And I have provided counseling at a group practice for families. So I have an extensive background in therapy. So I want to start off by just sharing some of what I consider alarming mental health reports. The Washington Post reported that the pandemic has caused nearly 2 years of collective trauma, and many are near a breaking point. I'm going to repeat that. The pandemic has caused nearly 2 years of collective trauma, and many people are near a breaking point. I think you'll agree that that's pretty disturbing. And the Psychiatric Times reported that there is an overwhelming demand for mental health services. And I think most therapists would agree. And most of us are overwhelmed with referrals. And the American Psychological Association reported that there is a surge in demand for therapy and new referrals, particularly for anxiety, depression, and trauma-related disorders. And so those are the prevalent mental health disorders, and those are the ones that I thought I would just focus on this evening because they are prevalent and because they are my area of specialty. I feel quite comfortable talking about it. So as was said, there is a surge in demand for mental health and new referrals. And these particular concerns are anxiety, depression, and trauma-related disorders. So tonight I'm going to talk about anxiety, give you brief information. Mental health is so broad, and there's so much I could say, and I thought it would be best to speak on these prevalent disorders, but give you enough information that hopefully it will help those who may have loved ones who are struggling with these prevalent disorders. You can direct them in the right direction. So anxiety, when you think of anxiety, you think of excessive fear and worry, and depression, a feeling of sadness, despair, and hopelessness. And trauma. Trauma is when individuals have experienced stressful, frightening, or distressing events. Now, compassion fatigue is another concern because these individuals experience emotional and physical exhaustion due to caring for victims of trauma. Now, these individuals can include healthcare professionals, clergy, teachers, caregivers, parents, just to name a few. So I'm going to talk a little bit about anxiety. This is, again, one of the areas of my specialty. And here are some of the signs and symptoms of anxiety. And these are just a few. But when you think of anxiety disorder, it's experiencing occasional anxiety is normal. We all have experienced just normal everyday anxiety, but we're talking about anxiety disorder. So people with this disorder have what we call intense, excessive, and persistent worry and fear about everyday activities. And the thing about anxiety is I really stress to my clients that it's nothing to play with, because it affects 4 areas of your life. It affects your physical, your body. It affects your feelings, your thoughts, and your behavior. And so just look at some of the symptoms, the bodily symptoms of nausea, trembling, tense muscles, chest pain or pressure, frequent urination, increased heart palpitations, shortness of breath, rapid breathing, tingling or numbness in arms and legs, choking sensation, dizziness, lightheaded, hives, pimples, sweating hands or body. Those are just a few of the physical symptoms that individuals experience with anxiety disorder. And when you think of your feelings, people feel nervous, tense, wound up, jumpy, frightened, fearful, irritable, or impatient. Your thoughts, when you are suffering from anxiety disorder, you have fears. Your fears are irrational, they are baseless. But there's a fear of losing control, a fear of being unable to cope, a fear of physical injury or death, fear, poor concentration, confusion, or distractibility. And again, these are just a few of the symptoms of those who struggle with anxiety disorder. And behavior symptoms, these include what we call the fight, flight, freeze response. So some people, when they feel anxious, they will become very aggressive and will fight their way through. Others will flight, they will flee the situation, avoid a frightening, disturbing, anxious experience at all costs. It's just avoid, avoid, avoid. And others will freeze, just simply shut down and do nothing. And other symptoms of restlessness, agitation, pacing, hyperventilation. And so these, again, are just a few of the symptoms of anxiety. So treatment is very important. If you do feel that you are suffering from anxiety disorder, I would advise you to consult with your physician because there is therapy for that. Cognitive behavior therapy is an approach that I use, and it's effective for those who have anxiety. So you're probably wondering, well, what is cognitive behavior therapy? Well, it's a type of therapy that teaches you about unhealthy thinking patterns and how to identify your thinking patterns and then to challenge those thinking patterns and replace them. It has been very effective with many of my clients. Exposure therapy is another treatment, and this is where the therapist and the client work together to gradually face that fear that is producing the anxiety, to break that cycle of avoidance. And relaxation techniques are powerful tools for those who are struggling with anxiety disorder. So techniques such as deep breathing, progressive muscle relaxation, mindfulness, all of these tools and techniques bring relief from symptoms of anxiety. And of course, there's medication for those who, after consulting with the doctor, it's been determined that that would bring you some relief. But again, medication does not solve the problem. It helps to manage the symptoms. So next, we'll talk about depression. It is a mental health disorder and should not be taken lightly. Should not be taken lightly. So here are signs and symptoms of depression. Depression is a feeling of severe sadness. It drains your energy, hope, and your drive. Depression can be mild, moderate, or severe. And here are some symptoms. And as you can see, there are quite a few. Persistent sadness, anxious or empty mood, feelings of hopelessness, pessimism, feelings of guilt, worthlessness, or helplessness, a lack of interest or pleasure in hobbies and activities, decreased energy, feeling slowed down, difficulty concentrating or remembering or making decisions, difficulty sleeping, early morning awakening or oversleeping, appetite and or weight changes, thoughts of death or suicidal attempts, restlessness, irritability, persistent physical symptoms, low self-esteem. All of these are symptoms of depression. I've heard a lot of people say that they never truly understood the signs and symptoms. Here they are. Don't take them for granted. If you feel a loved one is suffering with depression, check in with them. And there is treatment. There are many treatment options for depression, and it just depends on how severe it is and what works best for you. Medication is appropriate in some situations. Therapy works, exercise, meditation, healthy eating habits, all of these can help. I would advise you to consult again with your physician for the best treatment option. Different people have different problems, so the doctor would know what would work best for you. And the last prevalent disorder is trauma. Trauma is something that is very complex. There are different types of traumas. I don't have the time to talk about the different types and causes. But one thing I think is important to know is that trauma is a powerful emotional response to a distressing event, such as a pandemic, an accident, violence, the unexpected loss of a loved one, or abuse. And so some of the symptoms of those who have experienced trauma, they will avoid anything that reminds them of their trauma or will trigger any kind of memory. Oftentimes they have flashbacks of a traumatic event. They tend to be very exaggerated in their startle response, very jumpy, edgy, noises sometimes, unexpected movements can be very disturbing. They have distressing dreams and sleep problems when they suffer from trauma, irritability, quick to anger or aggressive. They tend to self-blame regarding the traumatic event, and they're frequently scanning the environment. And there is treatment, again, for those who struggle with trauma. Cognitive behavior therapy works well, again, for those having trauma. Exposure therapy, again, is helpful. EMDR is helpful, which is something, again, that I use, and it has been very powerful for many of my clients. Some of my clients have experienced healing of their bodies through EMDR. So I've just seen some very powerful results. Group therapy for victims of trauma, survivors of trauma is also helpful. So one of the things I think is important for individuals experiencing grief, loss, any kind of trauma-related disorder, trauma, or anxiety, coping skills, learning how to manage these symptoms, learning how to take care of yourself, I think is so important. And so I spend quite a bit of time with my clients teaching them self-care strategies. And I've always said, they work if you work them. And so what I appreciate about the work that I do and the training is that I can incorporate the spiritual as well as the psychological together, because they agree on a lot of what I bring to my clients. And so self-care, we have a scripture here that supports taking care of yourself. And it says, "Beloved, I pray that all may go well with you and that you may be in good health and it goes well with your soul." And of course, there are other versions that say, "I would that you prosper and be in good health, even as your soul prospers." I believe that God wants us to prosper and be in good health. And so when you talk about self-care, well, most of us didn't grow up learning about self-care. Many of us never heard of self-care until we were adults. I know I didn't. But what is self-care? Well, self-care is any action that improves your health and well-being. And the National Institute of Mental Health reports 6 elements of self-care. So we have the physical, the psychological, the emotional, the spiritual, the social, and the professional. All of these areas are important. We can't ignore one and focus on the other. They're all important. And I love the scriptures, again, that address self-care, and I just thought I would choose a few. The Bible says in Ephesians 5:29, "For no one ever hated his own flesh, but nourishes and cherishes it, just as Christ does the church." And finally, brother, whatever is true, whatever is honorable, just, pure, lovely, commendable, if there is any excellence, if there is any worthy of praise, think on these things. Now, if that's not cognitive, talking about your thoughts, that's CBT. That's learning how to shift your thoughts from negative to positive. So I just really love this, that even the Bible honors the meditation, the thought processes, focusing on positive things. That's just good self-care. If you can manage your thoughts, you have truly done something. Also in Luke, it says, "But Jesus often withdrew to lonely places and prayed." So that meditation, that quiet time, a time to be still, is a part of self-care. And then in Hebrews, there remains then a Sabbath rest for the people of God. So it's important for us to rest from our labor, to reflect, to energize, to be restored. This is all good self-care, and it does help to manage anxiety when you practice these self-care strategies. And then in Peter, 1 Peter, it says, "Cast all your anxiety on him, for he cares for you." So we're not to be anxious. We're supposed to give this to the Lord, and he will give us rest. Here's 5 benefits of self-care. It slows you down, makes you more productive, helps boost your immune system, helps you discover who you really are, enables you to have more to give others, and improves your self-compassion. And perhaps you're wondering, what is self-compassion? It's really simple. It has 3 components, and I do teach this to my clients. Self-compassion is one, it's just showing yourself self-kindness. And self-kindness means not criticizing yourself, calling yourself names, putting yourself down, beating yourself up when you make a mistake. It's recognizing, number 2, common humanity, that we're all human, we're all subject to error, we're mortal, vulnerable, and imperfect. So it's just recognizing that you're human, you're part of the human race, and that we make mistakes. And then third is being mindful, recognizing that, yes, I make mistakes, and I want to have this balanced approach about it. You know, I don't want to ignore my pain. I want to minister to my hurts, but then I don't want to exaggerate the pain. So it's just having a balanced approach, recognizing that there are those negative emotions and there are the positive, and I don't want to suppress and ignore. I want to tend to it. And so that's self-compassion. It's just being kind to you. In other words, treat you the way you would treat a good friend or a child that came to you broken and hurting. Would you push them away and tell them get over it, or you don't have a problem? Would you belittle them if they're hurting and broken? No, of course not. You would encourage them and comfort them, and you would nurture them. So do that for you as well. Simple self-care strategies. My motto is, if you fail to plan, you plan to fail. And that's a quote from Benjamin Franklin. So you have to have a plan when it comes to self-care. And these are just some simple things to keep in mind. That enough sleep is important. Get enough sleep, 7 to 8 hours. Exercise is important. Stretching even helps to reduce tension and anxiety, helps the body to relax. Think about what helps me to relax, what helps me to feel good. Eating healthy, drinking plenty of water, avoiding things like alcohol, drugs, and you definitely want to avoid cocaine, amphetamines, and marijuana because it contributes to anxiety. And then limit Limit your exposure to the news, social media. It can be very toxic and negative and depressing. So that does not help. If you're suffering with anxiety and depression, you just have to be really careful about that. Ask for help if you need it, and relax and recharge. And there's different ways to relax, but that's important in helping to reduce anxiety. And practicing deep breathing exercises. There's all kind of deep breathing exercises, but that's helpful in helping the body to relax, to calm down during some stressful events. Setting healthy boundaries, learning to say no is important. If you have too much on your plate, reevaluate, set the priorities. Sometimes you have to say no to people because you can't be everything to everybody. And connecting with others, that helps when you're feeling depressed, connecting with people who care about you, who love you and validate you. And then doing something for others. Sometimes that just takes the attention off you, when you're feeling sorry for yourself. Sometimes just helping somebody else helps you feel better, helps you feel good. And then, of course, using your moral compass or your faith to guide you in your decision making. Set and maintain a routine helps you to feel calm, to feel organized, and it reduces anxiety when you can clear clutter. That's clutter in your house, your room, your office, and then focus on things you can control. Oftentimes, people will focus on things they have no control over, people they can't control. So focus on what you can control. Laugh and laugh and laugh again, because laughter is like medicine. It will help to heal wounds. And meditation is powerful. Dr. Bill Winston said meditation brings revelation, and revelation brings revolution. Meditation is powerful. Don't have a lot of time to spend on that, but that is one of my favorite topics. And of course, developing an attitude of gratitude can help in minimizing not only anxiety and depression, just help you to see things differently, have a different perspective. And here's just some information about gratitude, the benefits. People who have an attitude of gratitude, they experience higher levels of positive emotions, life satisfaction, vitality, optimism, and lower levels of stress. People with an attitude of gratitude are able to shift their focus from the negative things in life to the positive things in life. And these are just some exercises if you want to practice having an attitude of gratitude. You can write every day about things that you're grateful for. Writing a letter to someone you appreciate, visiting someone you appreciate, just learning to say thank you for the little things every day, and the people you come in contact with, just saying thank you, or taking a gratitude walk. All of these are wonderful self-care strategies. Your health, your mental health is very important. Your psychological, emotional, social well-being, it has an impact on every aspect of your life. Positive mental health, it allows you to effectively deal with life's everyday challenges. So if you're struggling with mental health challenges, get help today. For mental health counseling, you can consult with your physician. You can even contact your insurance plan. Some employers provide EAP, Employee Assistance Program. There's Psychology Today, where you can find a therapist. And there's therapy for Black girls. You can also find a therapist. So there's different ways that clients can find, that my clients have found me, and many of them was through these resources. In my conclusion, I want to say that people have better resources. When they have these better resources, they can make better choices. And so I'm leaving today resources for self-care. On my website, there is a wealth of information on self-care strategies. There are other sites here available. Free self-care resources, My Intent Project, top 15 self-care resources for 2021 for teens and adults, and 20 self-care resources to help you heal and survive. And last, if you are experiencing a crisis, there is the parental stress line that you can contact. There is the National Suicide Prevention Lifeline that you can also contact. There's Military Crisis Line. There is the Trevor Lifeline for LGBT youth and young adults. There is the National Domestic Violence Hotline that you can also contact, and the Crisis Text Line that you can text. All of these are great resources if you or someone you know is struggling and is having a mental health crisis. So I want to thank you for this opportunity to share resources, and hopefully after today you can make better choices. God bless you, and thank you so much.
Thank you, Dr. Storr. That was some excellent information that you share with us. And I hope that those that are listening will take advantage of that great amount of resources. A couple of things that you said that I want to address on. One of the things you said, and you talked in Ephesians 5:29, said, "For no one hated his own flesh, but nourish it and cherish it as Christ does the church." And that's Ephesians 5:29. And a healthy individual will nourish and cherish themselves. Unhealthy person will not be able to do that. And so when you see someone that has negative self-talk and they're putting themselves down, usually that's a problem, low self-esteem and issues like that. Also, when you talk about Ephesians 4:8, I use that constantly many times and with clients, getting them to think positive about themselves. We're going to bring our other two guests on. Welcome back again. Going to bring them back on again. Thank you for your patience. Thank you. We have Beverly Howard that's online. She's in the background. We're going to bring her in a few minutes. We try and bring Leah. Leah, are you on here?
Yep, I'm here.
Okay, Leah, do you have any comments or anything you want to share with us regarding that great presentation, or something that you want to share with the audience that you think is important?
I just love the discussion on self-care. I think everybody needs it. It is like a new wave, like the older I got, I realized that, self-care is really more important every day. Whether that's just, on your lunch break, going outside and going for a walk, or I hear my echo. Do you guys hear an echo?
Yeah, I hear a little bit. That's all right. We can hear you though.
Okay. So if that's just going for a walk or taking a bath or sometimes even journaling, just finding out what your body needs, whether it's emotionally or physically, and providing yourself like that care is what really sticks out to me. So I wanted to piggyback on that because I loved everything that was mentioned.
Well, thank you very much. And don't go anywhere because we want you to answer some questions to some of our guests. Christina, would you like to say regarding to? I just thought it was excellent. Would you have anything to say or any comments, Christina?
Yes, you said it all. Everything that needs to be said, from the education piece of the different diagnoses and just education about trauma. I really liked how you incorporated the pandemic into like how that can be a traumatic event. A lot of people were struggling during the pandemic or felt like they needed to be doing something, but it was an experience for all of us, and everyone coped differently with that, and just unfortunately losing jobs and so forth. So I appreciate how you mentioned that, and then even the coping skills and just doing what works best for you as far as coping and that self-care.
Yes.
It was a great PowerPoint. You might have to send copies out.
Well, you're welcome to have it. That's why I put it together.
And thank you for sharing it with, the reason why I chose to do this topic, and because being in the mental health profession, I feel like I would be remiss if I didn't do it. I'm thankful for one of the panelists there who reminded me earlier in the month it was Mental Health Month. I don't know how I've forgotten it, but once I did,
We were busy doing the work.
Yeah, exactly. And so, I had a schedule of different things that I was going to do for tonight, but I had to call and cancel and say, hey, we're going to have to push you off. We have to this mental health, because I think, and you all can probably agree with this, this is something that's so important, but it's often taken for granted. And a lot of times people say, well, I'm a Christian. That does not exempt you from having mental challenges.
Absolutely.
Because you're a Christian doesn't mean that you're not going to have mental challenges. It does not mean that you're not going to find yourself faced with a sad situation that's going to cause depression. I think we all can experience, and you all can respond. We can all experience some degree of depression. The challenge is, how long does it last?
Mm-hmm.
You know, some people can experience it for a day, a week, a month, a year, hopefully not years. But even a child of God can go through depression or a sense of loss and a sense of helplessness. What do y'all think about that?
Yeah, I think you're absolutely on it. And this is not to throw a criticism out to anyone in particular, but I think what would help Christians more if we were taught from the scriptures, those Bible characters who experience fear and anxiety and depression, because it's clearly illustrated in the Bible. There were many of God's leaders who were very fearful, anxious, depressed. I mean, I'm thinking about Gideon. Gideon was very fearful and anxious, and the Lord came to him and called him the opposite of what he actually was. But he was fearful and he was nervous and hiding. So I think if we would just help people be okay, that they can hold both things. They can be saved, they can have God, and they can also be fearful. They can also feel nervous or feel depressed, but we don't allow it to destroy us because we have hope. You know, so we remember the word and we speak that word over our lives.
Mm-hmm.
I know I've been saved since I was 16, but I would be remiss if I said I've never experienced depression since I was saved. I've never felt afraid. I've never been nervous. That would not be true. Mm-hmm. But I'm still here today. I'm still serving Christ, you know, and it's the word of God that keeps me encouraged, the prayers. There are just a number of things that keep me encouraged, but I have those down days too. I think if we were honest, we all have had them. Mm-hmm. Even during the pandemic, I've lost loved ones. I've lost friends. It has not been easy. It's been a horrible experience when you think about all your friends that you've lost. You know, to sit here and pretend I have not been impacted by this pandemic would be dishonest. It would be deceitful. So yes, as Christina says, we've all been impacted in some way.
I think what's important, I think that's why this panel is important, because it's the resources that you have when you're dealing with depression, when you deal with anxiety, when you're dealing with the stress. Is having the resource, having the tool, having individuals that you can talk to. And that's why a therapist is so important. Having someone that you have the confidence in and someone that you have confidence in, and you know that they have the knowledge and the resources to be able to help you. And that's so important. We're going to bring Beverly Howard on. She's been on here since the beginning of the program, waiting to come on. Sister Howard, are you there? Welcome to It's My Turn Now.
It's my turn now. Praise the Lord to everybody, and
Hallelujah.
Thank you so much for the presentation. This is a great ministry. Dr. Alex Starr, I remember you were over at Christ Temple Apostolic, and you had the book, and that book was so very helpful. The mental health thing is very important. I believe that it gets shut down a lot. People don't think that there's a such thing as a mental health. And mental health is growing and is out there. But I'm glad that there are people like you and Bishop Walton and Sister Christina and Sister Leah. All of you guys are out there trying to help us. We really appreciate you.
Amen. God bless you.
All right. Thank you very much. And I appreciate you. I appreciate you. I appreciate your coming on and your response each week. You always support this right here. But I think it's important, and I'm going to start with you, Leah. Tell me, Leah, What is your passion in your mental health field? What's your passion? I think everyone has a certain passion that they have, or something that they that motivates you and drives you, and something that helps. Hey there, how you doing? Got extra guests on here. All right.
He got out of his
And then
bed.
is that a young therapist right there?
Sorry, he got out of his bed and is back with me, so he'll just hang out for a little bit.
That's all right.
But my passion, I just really love working with children. I really love working with children. I want to be almost the Nick. Sorry. I just want to be the voice in their ear. Sorry, I'm gonna actually, if somebody can go next, I'm gonna tend to him, and then
I'm just going to say something. Thank you, Leah, bringing your son on. But these are things that happen every day on a daily basis. And Dr. Starr, you raise children. Beverly, you raise children, and a lot of times just coping with kids. You're dealing with your everyday life, and especially I'm glad I'm past those stages when I had the little one, the little infant. But those are things that can cause a lot of stress. There's been things in the news where parents have abused their child, and some have killed their child. Just those little things that we wouldn't think about can be stress. I'm looking at you, Lee, as a parent, working full time, having a child, and that can be very stressful. And we just have to admit it. We just have to face up to, hey, I'm having stress. It's bothering me, and when you find yourself being overwhelmed, reach out to someone.
Yes.
We'll let you continue, Leah, what you were saying.
yeah, I have 2 under the age of 3, so and working full time, so it gets real, but it's a blessing. But I was just saying, I want to be the voice in the children, like in their head, almost, almost like a parent. Like you can hear like your mom's voice, you can hear your dad's voice. I want to be like that for them, almost, just like a mentor aspect. So what did Miss Leah teach me when I was in 2nd grade? Or what I remember this activity that helped me with anxiety as, they age and go through middle school and high school. So that's really my passion, is just, there's so much darkness in the world, and just, I just want to be a light in their world, and shape them to know that there is hope, and there's people that care for them. And there's interventions and techniques that we can learn, at a young age. So then when you get older, you can, pull out that toolbox and know what this person taught me or this therapist taught me. So I'm really passionate about children and adolescents population, and just helping them as they age.
Amen.
Yeah.
We lost him.
Mm.
She might be calling.
I found one of the challenges is that I'm just recently coming. I don't know about either of you. I'm just recently having more Christians seeking counseling, which I think is a good thing. More Christians are seeking counseling, and African Americans are seeking counseling more so in the last few years than ever. But I heard interesting statistics today. Well, not statistics. Fact today is they're saying that a lot of the kids, because of the pandemic, are 2 years behind in their social skills. Has anyone heard that before?
Are you saying due to the disruption in the classroom?
Due to the fact that they have not had the interaction. Normally the kids, during the kids going to prom, they go on dates, they go on different places, they're interacting with the kids, and so socially, it has affected them. Not having that social interaction. A lot of them were at home. They strictly doing more computers and more things like that, and not really interacting. And that's a very important part of a healthy being able to interact with other people.
Absolutely. Leah, have you noticed a difference there?
I definitely noticed within the younger ages. So like your first, second, third graders who, um, their kindergartner experience was in front of a computer and doing circle time and logging in and logging out. I've noticed maybe a little bit, but also kids seem to be really resilient from my experience and are able to just bounce back and almost adjust. Like I was just admiring my 3-year-old, when COVID was happening, like just wearing a mask almost like it was a part of his costume, not knowing that that's not normal, to wear a mask every day to school. But I mean, I just see that kids are just able to kind of go with the flow and are resilient. So I think more so now it seems like things are back to normal and kids are able to engage and interact. But I did notice that in the past, yes, for sure.
Yeah, very good. Sister Rose Maxey says, my turn now. Good question. Does mental illness affect women differently than men? I don't know how it affects. I can speak from my perspective. I'll let you ladies speak from your perspective. And I'm not trying to sound sexist or anything like that, but I do think, and let me frame this right here. Let me frame it. Women tend to be a little bit more emotional in certain situations than men, or for the most part, women are more expressive of their emotions. Is that a bad way of putting it, ladies? Without getting in trouble? I ain't getting no amen from nobody.
I personally don't feel like there's a difference. I just think it really just, depends on how we cope with the mental illness. We all, have different things going on, but it's how we cope with it. So I haven't personally noticed a difference with gender. It's really just what's in that toolbox, like what we have this issue, we have this root. How are we going to adjust and change and cope with it? So, but that's just what I've observed in my practice.
Yeah,
Christina, you can't let me hang, Christina.
No, I'm saying
Christina,
I hear what you're saying, but I agree with Leah. I mean, at the end of the day, they're all struggling with some form of, anxiety, depression. So my depression might look different than somebody else's, but like Leah said, it's still a root issue. So I might express that differently. And that's why I can kind of hear what you're saying. Maybe women are more expressive of like their struggles and stuff. And that's another topic. Men might suppress those emotions or cope differently, but at the end of the day, the mental illness or the mental anxiety, the depression is still there. It's just a form of how you express it or choose not to express it.
Yeah, I would say that she said, does mental illness affect women differently than men? No, I don't think it affects them differently. I think, as Leah and Christina have said, the expression of it is different. It looks different. But then again, I can't say that women express differently than men because there are many factors, how people are raised, environmental factors, personality differences. And so we don't want to stereotype and say women act this way and men act that way. I think that would be inappropriate. But it does affect us all, but how we express it can be different.
Mm-hmm. I think it's very good. And I will say this right here, many times, and society is changing, but the norms of society makes women are more able to express themselves without being stigmatized. And I guess that's what I'm saying. But it's changing, so men are able to express themselves a little bit more. But used to be a time men were not able to express themselves as they are today, and because of that, a lot of times men internalize their problems. They keep their problems in. They hold their problems in until also, and that's, I think a lot of men deal with a lot of stress, a lot of depression, a lot of hypertension. Because of holding it in. So, and that's why I get that from that. But I do agree it could affect anybody anyway. Lady Fennell, let me see. Hold on. My computer's just going a little bit slow here. So. Okay, let me go ahead and read what she's saying. Okay, there it goes. My turn now. Men have been taught to not express or even deal with their emotions. Exactly, that's what I was just saying. Especially in the past, boys, men were taught not to cry or belittle if they did. Thus, it appears women may be more emotional. You're so right, Lady Fennell, and that's what basically I was saying is that we were taught. Men were taught you can't. Boys don't cry. Suck it up. You know. And women were allowed to cry, you know. And even now, you know, some ladies say, "Well, I like a sensitive man, a man that's sensitive." But how many women want a man that's crying all the time? I ain't saying that. Still don't want a man, but lady can cry all the time. Oh, bless her heart, she's so sensitive. So maybe that's my point. Okay. Hey, thank you, Lady. Now, let me see, Sister Jamie Gonzalez. My computer's running a little bit slow today. I don't know. Same computer. Some days is like that. Sister Jamie Gonzalez says, "My turn now. I appreciate the great information by Dr. Starr. She is so transparent with her truth when she says we all have some type of mental stress. Most won't admit that that's why their medical health can be disturbed, like high blood, diabetes, and other illnesses. I'm thankful during a traumatic situation, including pandemic. I have a therapist and God. Also, statistics say 86% of prisoners have a mental illness. That's so true. I agree with you, and I think it. You know, it's good to have people that are transparent. And I think in the church, we do need to be more transparent because not only are the parishioners having some mental illness and stress, and when we talk about mental illness, there's various degrees of mental illness. So because this person has a mental illness, don't think that doesn't mean that they're incapable of functioning properly. It means that there are some things that can impede their ability to function properly. So you don't have to be totally in left field in order to be considered having a mental illness. And so sometimes we think a person has a mental illness, we exaggerate, you know, to what degree that mental illness is, and we have to be aware of that because there are a lot of people who have mental illness and deal with things, and you may not know it until it's too late. So
yeah, I think the name mental has a stigma attached to it, like you're crazy or hallucination and hearing voices, you know. But you think of a physical illness, you know, there's mental illness. You know, if you, like you said it so well, if it's interrupting your life in any way, whether it's working on a job, interrupting your relationships, if it's creating some kind of disruption, disorder, right? That's when it becomes an issue. But there are many people who are depressed, but they're functioning well, who go to work every day, but they feel sad. So the mild, moderate, severe comes in. It's usually when it's moderate to moderate, severe, and severe that you want to get help. You want to manage those symptoms. But as I said earlier, I don't think we can live in this world and not at some point feel depressed about something, you know?
yeah.
So we just have to keep everything in perspective. We're not suggesting that when you have a mental illness that you're crazy and out of control. That's not what we're saying here. We're just saying sometimes we need support, we need help to work through our traumas, our depression. For example, you know, there are people who are experiencing what we call prolonged or complicating grief. You know, you've had death after death after death. And so it's a complicating grief and they're stuck in their grief. And they need help with that. They need to process those losses. You know, we can't expect people to just get over it. They need to process. They need to talk about it. They need to grieve. They need to cry. Well, my question or my challenge that I would like to put out there, if there are pastors listening, can you open your doors to people who are hurting and develop support groups in your church to help people heal? There are people hurting out here. People need to cry. People need to grieve. People need to talk about their loved ones. They need to talk about the frustration and the anger of not seeing their loved one, or their loved one being left in the hospital to die alone. People need to talk. Can we open our doors and allow that space for people to heal, for people to cry? Can we do that? We say that the church is a healing place. Can we open our doors to a community that is broken? I'm here tonight, not because I got paid big money, not because I want a name, but because I want to help people who are broken, who are hurting, who need healing, who need oil poured into their wounds. They need compassion. And so I'm appealing to those folks who have the space. Open up your space. Allow people to come into your church and be loved, be prayed for, be encouraged, be supported. Open up the sanctuaries and allow people to share testimonies of God's amazing grace, his healing power. The Bible says that, it's the word of our testimonies. The power of testimonies can bring healing and comfort. And so that's my appeal, is that we will open up our doors and let those who are hurting and broken come in and be healed in the name of Jesus,
Amen.
through the blood of Jesus, the
Hallelujah.
power of the word. Let them be healed for God's sake.
Another thing is we have to recognize as a pastor, and the Bible says in a great house there are many vessels, some to honor and some to dishonor. And so we have to understand that we can't take things personally, even from the parishioners. Pastors have been known to take things personally. I'm going to say amen for the pastors that's not on here. I'll say amen. And so, and I'll give you an example with me. I had a parishioner, the one minute they were nice, they were just kind. The next minute they just as cold and callous and indifferent. And I'm thinking, what did I do wrong? Come found out they were bipolar. And so now here you're thinking, what's wrong with this person? They needed help. They were bipolar. There are other extenuating circumstances that affected them. Pastors have to realize that we want to say that's a devil in this person. They got the devil. They trying to do things. People are facing challenges. They don't know how to cope with their issues. And we have to help them. And we have to be kind and patient and endearing to them. When you see some of these folks that are really having problems, show them some love. Show them some love. You'd be surprised what difference you can make. You take it personally. If you take it personally, what someone says or what they do, then you will not be able to give them the type of help that they need. And so pastors have to be willing to understand they have a problem. It's not about me, it's about them. And so that's my suggestion to pastors and to therapists. As Buff said, back in the day in my past marriage, I was really impressed with the late, great Brian Johnson. Suggested that we go to a Christian marriage counselor who well understands how divine works from women to men. Thank you for sharing that with us, Ezra. I think it would be you have to, as pastors, tell the members, stay in your lane. Have y'all heard that before? Some of us pastors have to learn to stay in our lane. I ain't no plumber. All right. And, that's my vernacular. I ain't no plumber. I ain't no mechanic. So ain't no sense you bring your car to me and transmission is bad. And I said, let me take a look at it. I most likely it'll be worse by the time I get finished with it. Sometimes we have to stay in our lane. And there's nothing wrong with referring someone to someone and say, you know what, this is not my area of expertise. I'm going to refer you. And so pastors need a list of resources who they can refer to. Dr. Starr, her practice. I think Leah and Christine, I think you all work in a facility, a different setting. But you have to have a list of resources. That's part of holistic care of individuals. The holistic is saying we have to meet every need, all the needs of our people. There's a spiritual need. Yes, we need to pray for them, but there's a mental need as well. Since Rose Max said you might just answer my question, but for those that may not be able to afford a therapist, what are some of the other support groups or things a person can do to get help? And yes, churches should be a starting point. You're so right. there are places out there. I think the Metro just started a program, if I'm not correct, doctor, or anyone who knows that, where they're giving once a month free care.
I'm not sure about that, but I had mentioned that some employers have EAP programs and they're free. So people can check with their workplace because I've had many clients who've come to me and they got free therapy sessions through EAP programs. So that's just one way that I'm aware of.
Yeah. Most employers, they have the EAP and they'll give you 8 free sessions. I've dealt with a lot of clients who did not know it. That they did not know that you could get it. And I tell them, see your employer, your human resource, tell them, that you need to, they'll give you 8 free sections. And then if you have another unrelated issue, they'll often give you another free 8 sessions. I've had clients, I'm not, encouraging anybody to do it, but I have clients who just, we cover different areas of trauma, different areas that they have. And so they, the employer pay for it. Now, the resources that Dr. Starr gave us, hopefully on that, and it's difficult a lot of times if you don't have the resources, and that's the problem. And there should be more funding out there. Maybe there's some churches. We have some therapists out there. Maybe there's some churches that will want to establish a fund that they can refer people to them, and the church may want to sponsor that. What do you think about that, Dr. Starr? That's good.
I think it's a wonderful idea. There are some things they can do if they just strategize, come together, and talk about it. For example, Sister Rose. So here's one example. For those who are experiencing grief and loss, they can have a grief and loss group in their church that meets every week for, let's just say, 6 to 8 weeks, where people come together and talk about the grief and loss and actually go through a grief and loss class. It's like I do that with my clients. That's why I'm speaking that. I have a workbook that I take my clients through, and we talk about their loved one, and they have exercises that they do, and they can process that loss. A lot of people need to do that. They've not had a chance to do that. So that's a group effort that can be done through the church. Church just open the door, allow, register people. People can give a love gift, pay a registration fee. Or the church can sponsor it. But there are ways it can be done. And that's just one example of helping people who are struggling with grief and loss. But all it takes is for people to come together and begin talking about it and strategizing. I believe that all things are possible. When we do our part, God will make the way, but we have to do our part.
Very good, Dr. Starr. Lady Fennell, it's my turn. I would like to suggest that as we give space to pastors, their spouses, their family, and leaders in general to receive compassion, space to grieve, to be ill, etc., as they are human and experience the same thing as others. You're so right. I think sometimes, and I was sharing this with someone just not too long ago, we expect a lot from the pastors, and yes, we should expect a lot, but pastors are human, and we're very critical of pastors. Pastors need to be shown some compassion too. Give a pastor the benefit of the doubt, and because there's a high level of suicide among pastors. I don't know about as many Pentecostal apostolic pastors, but there are a high number of suicide among pastors because pastors are holding this up. And we talked last week. Who do pastors go talk to? Pastors aren't always comfortable to share their emotion with people, because if they share their emotion with the wrong person, they won't be able to take it. They'll say, "Oh, what's wrong with the pastor? Pastor's weak." And so many times the pastors just hold those thoughts in. And so we need to have compassion for them as well. Also, I would say, as you said, Dr. Starr, I think grief, there are a lot of people experiencing loss. I wrote a book called The Empty Quiver, and I've I've used that a lot of times in doing grief seminars. Grief, I used to lead a group for Overeaters Anonymous. Overeaters Anonymous, I led group sessions for them. And one person lost their dog. He actually bought the book because he lost his dog. So we have to understand grief can go across a wide spectrum.
Yes.
You can lose a dog, and that can be devastating. I've seen that happen a lot of times.
Mm-hmm.
There's so many things that can trigger grief, and we have to be sensitive to all those things.
Absolutely.
Christine and Leah, we want to hear from you too.
Ezra made a comment there.
Go ahead. Oh, okay. Let's see. Which one? Okay, hold on just a second. Let me see. Back then, we paid big money for 3 marriage sessions, and later found out that my job would have paid for that. So true. Thank you for sharing that, Ezra. I think it's important. Inquiring your job and ask them, is EPA Employee Assistance Program. EAP, I'm sorry. Employee Assistance Program. Check with your human service, your medical person. Lady Vanell, check with English Foundation. They may still offer free to minimum fees. Also, maybe the Christian Theological Seminary and 211. That's a very good source. 211 is a very good source. Almost anything you need to find out, they're trained to tell you where to go. And I'm sure, I would be sure to say that there are places out there that are offering some type of minimal services, and some service. I tell you what, when I was at Indiana Wesleyan doing my practicum, it was income based there. So you can go to places, especially when people are doing practicum, they actually need clients. So it was income based. We had some people pay $2, $3. I forgot about that, $2 and $3. You know, but it's income based. So there are resources out there. So. Let me see, Sister Sheila, just like diabetes and hypertension, some mental illness require medication. That's so true. You know, and let me ask you a question. I think it's sad. I think that people in the church frown upon medication. They do. I think people in the church frown upon medication. But you know, you take high blood. Let's just Sheila say you take high blood pressure, you take diabetes medicine, you take medicine for ulcers. If you need something to help you kind of keep it all there, keep it balanced, do what you got to do. Do what you have to do. To thy own self be true. You know, you just have to take care of yourself. You have to nurture and take care of yourself.
And I mean, I think we should, I mean, maybe you aren't aware, but I know I'm aware of some individuals that simply would not be able to function without the medication. They would not be able to function. And so we thank God for the medication. We thank God for God giving man wisdom and knowledge how to treat. So we don't want to despise it when there are people who really couldn't even live without the medication. So it's a blessing for many, but anything can be abused as well. There are people who abuse medication. So what we're talking about, when you know that you cannot manage your symptoms, you are struggling, your life is disruptive, you cannot function on the job, you're having problems getting to work every day, focusing, having problems in your relationships, then that's when you want to get help. Just get diagnosed, find out what it is. There are people who didn't know they had ADHD until they went to the doctor. They were struggling with just focusing, couldn't focus, very disorganized, didn't know what was happening until they got diagnosed. And then they got diagnosed and got on medication, and they've been able to focus, actually work productively as a result of medication. So we want to be careful about getting on these bandwagons and criticizing medication when it has been a blessing for many people.
Very good. Let me see. We've about run out of time. So good. You know, the transmission has not been the best on this program. I don't know why. Charge to AT&T Internet. I don't know what it is. We may have to do this program again. Get you all on here when we have a better internet service. I don't know what my bill has been paid, and I try to get the best internet service I can get, of course, through AT&T. But hopefully it'll get better because there's a lot of feedback here. Rose says, actually, how do you determine if a child needs a therapist, not a slap on the behind, and at what age or point should we seek a therapist for a child? What are signs that we should take serious? That's a very good question. Some people will say they need both. I'm not saying me, but I'm saying both people say they need both of them. I'll let you, Christine, you smile, so I'm gonna let you go first on that one.
I think a lot of the things are situational, but I think with this generation, just talk to your kids, no matter what the age. Teach them those that it's okay to have emotions, to express themselves, because you never know what they're going through at daycare or at school. That's a whole 8 hours of their day, and something could have happened. So, if they're displaying these behaviors, allow those outlets for them to be open and see what's going on. And I think that could change a world of things in the future. And then you can determine from there. But, instead of just punishment right away, talk to them. What happened? Tell me what's going on. How are you feeling? And yeah.
Very, very good. You brought up a good point because, when we're coming up, parents didn't ask you how you feel, honey. They just address the behavior, not the cause of the behavior. It wasn't a baby, what's wrong with you? I told you to sit down. I don't care what you're doing with. I told you to sit down, and you feel you're going to get it. So I think there's some validity that you have to say, to understand why. Because many times kids are acting out, but they're acting out for a reason. We know that now. Parents didn't know that when we were coming up. Because I was one of those acting out. I got a lot of spankers. They didn't care how you felt. They didn't care that you had a bad day. They just responded to behavior. I'm gonna let you answer, Leah, since we just saw that you had your son on here. Leah, tell us what do you think about that?
I like to think like if it's impacting their ability to do something. So if they're not able to sleep at night, if they're not able to make friends, if they're not able to, I don't know, get on the bus, if there's been a change in their life, then that's when I'm like, okay, what's going on? Like, what's in your heart? Tell me about this. And then that could kind of like sparks up, would they need it? Would they benefit with a therapist? So that's my little motto in life. Is it impacting their ability to do something? So.
Yeah, I think the younger generation, they're more inclined to just say, let's talk to this child. Let's sit this child down and talk to them. I think that's very good. When that don't work, then I'll say this right here. You have to find other alternative methods. Is that correct, Dr. Starr? If that don't work, then find some other methods that work. Okay.
Well,
okay.
You have to allow me to speak from the perspective of a therapist. I mean, I've had kids who have had a history of expensive abuse. And I've had adults who were abused as children, who are struggling as adults. And kids that have been traumatized, as I think it was Christina who said, talking to them and seeing how their day went, because you don't know what they have encountered, even at school. I've been in and out of the school systems, and I've seen some pretty disturbing things that I've had to report. And I'm just walking down the hall to see a kid, and I have seen. I've been in and out of the school systems, and I've seen some pretty disturbing things that I've had to report. And I'm just walking down the hall to see a kid, and I have seen. I've been in and out of the school systems, and I've seen some pretty disturbing things that I've had to report. And I'm just walking down the hall. You hear?
Does someone have more than one device? If you have more than one device, that could be it as well.
Okay, it stopped.
Okay.
So I was just saying, I've seen a lot of things that have happened in the school system. I was just walking down the hall to see a kid, and I've seen some pretty disturbing things that I've had to report. I mean, go right to the office and report, where a child was verbally, emotionally abused in the school system by an adult. And there was just no justification whatsoever for it. So I've seen some pretty disturbing things that left me sick to my stomach when I left that school. And so I agree with Christina that I think it's important to talk to the children, find out how their day went, ask them, what did you do in school today? Even do surprise visits if you can. I don't know about COVID now, but just check on your children, because there are a lot of disturbing things going on in the schools that children are experiencing. And so they come home angry and upset, and you have no clue why they're moody, why they're angry. And so it's just important to communicate. As Christina said, keep in touch with what's going on in the classroom. So, and then, I mean, this is just a fact. Then you have children who have been abused by family members. So parents leave kids with family members or whoever, and they're abused physically, sexually. And so kids are acting out a lot of times, and you don't always understand the behavior, but sometimes they're responding because they've been abused and they don't know how to talk about it. Sometimes they're too young to talk about it. Sometimes they've been threatened, afraid to talk about it. So behaviors can mean a lot of anything. It can mean that they want attention. It could be attention seeking behavior, or they haven't had enough attention and they just need somebody to love on them, someone to talk to them, someone to pat them on the back, someone to say, you're so smart, you're so beautiful, you're intelligent. They just need to hear that. It might be just attention seeking behavior, or it could be signs and symptoms of abuse. So that's really my take on behavior problems. I would be slow to beat a child, whip a child, and I would be quick to listen and to love and to provide the nurturing and attention that every child needs.
Right. You know, when I was working in the school system, I told the classes that if you act up, you're gonna have to come sit next to me. You know, being forceful. You act up, you'll come sit next to me. And this one kid kept on acting up. I got so frustrated. I said, "What's wrong with this kid?" And one of the other kids said, "Mr. Walden, he's just acting up because he wants to sit next to you." That was reward. So his negative behavior. All right, let's try it again. The whole thing went off. His negative behavior was simply so that he could get attention. I had another student that I told him, I said, I would go around to all the kids, you're good, you're smart. And one kid said, "No, I'm ugly, I'm dumb, and I'm stupid." And he was emotional about it. He yelled the more I tried to get, because he said, my daddy's girlfriend said I'm ugly, I'm stupid. So now this is his self-image of himself.
Yeah.
So he's act out, and so we don't know what these kids are going through. There's so much that they have to go through. We run out of time. Let me see. We respond to a couple more questions, then we're going to end for the night. Give everyone a chance to say something. I don't know what's wrong with the computer here. Is Baby Howard said, "I was glad that my youngest daughter expressed her feelings during her last junior high school experience during COVID." Thank you for that. As breakfast, I have a family member that if she doesn't take her mind medication, her mind will go seriously left. Take your medication is very important. Some people have some chemical imbalances. There are some things that we call everything that it's the devil, and some of it's the devil. I give the devil some credit for that, because he will mess with your mind. But some of it can be a chemical imbalance in the brain that requires that medication. Hey, listen, I ain't against nobody want to take no medication. If you need some medication, help yourself. God bless you, because hey, more power to we. If you need it, it's going to help you. Take it, take it. A lot of these people in prison, as someone said, a lot of these people in prison, they are psychotic and homicidal. They need the medication. Had they taken their medication, I just saw a story today where a gentleman stabbed his girlfriend to death and her 13-year-old son, 11-year-old son to death. And they say he was on medication. Of course, he was doing some extra drugs, self-medicating. That's what we call self-medicating, taking some other drugs. The last question, says Rose Max said, "Thanks to all you for this free and informative." So it's cutting out, and you know what the church would say? There ain't nothing but the devil. Nothing but the devil. Ain't that what we say? There ain't nothing but the devil causing this thing to go out. Well, I ain't gonna say it's the devil. I'm saying it's technology, AT&T's internet service. I think that's causing that. Like we lost Sister Dr. Starr, so we get.
I'm here. I'm still
okay,
here.
we just don't see. Okay, last one. Says James Gonzalez said mine was before Beverly. Oh, okay. I'm sorry. I didn't even see that. Thank you. Hold on just a second. My computer's acting up. Okay, Sister James Gonzalez said, do you think the 18-year-old who killed 10 in Brooklyn, New York, had a mental illness? Your feelings. I'll let you. You can't see Dr. Starr. We'll let you respond to that.
I cannot speak to that.
Mm-hmm.
No, I cannot speak to that. I would be giving my opinion, and I don't think that that's appropriate. Just coming from a mental health perspective, I can't speak to that. I do know that people do things for different reasons. Some do it out of hate, pure hatred. It's a racist act. Some people do things, acts of violence, because they have mental health issues. Some people do it because of anger and rage and unresolved trauma. So there are a lot of people walking the streets that are doing and have done some cruel and humane things. But we can't assume that they all have mental health issues. Some people use it as an excuse to just do what they want to do, murder people. So I can't speak to that individual. I'll just say in general that there are many reasons why people destroy another person's life. Would you say that the people who invented slavery and murdered people and hung people, killed innocent people, destroyed babies, do they have a mental health issue? So there's some things I would choose not to give an opinion. I would rather know the facts. The person needs to be assessed. They need a psychological assessment to determine that.
Very, very good response. Some behaviors are learned behaviors as well. I've dealt with clients who were abusive to their spouses, to their mate, and they said, "Well, I saw my dad do that. I saw that." I dealt with a client that dealt with anger issues, and one of the first things I will ask client, "Have you been abused as a child?" And so a lot of times people who are abused as a child becomes an abuser. So there could be a lot of different things, and I agree with you on that. All right, listen, we're so thankful for each and every one that's all the comments. We're gonna have to do a part 2 on this right here, and hopefully we'll every once in a while. I've done many programs. I can count maybe 3 times when I've had this type of problem. I don't know if AT&T was with them, but we're going to go wrap up and get each one an opportunity to say something. Let me see. Well, we lost Christina. Leah, we're gonna start with you. Give us about 60-second summary wrap up, or just share what's on your mind.
Really just thank you for having me. It's been a great opportunity to listen and to participate. I did want to piggyback on CTS, the Christian Theological Seminar, being a great resource. They have students and interns, and they do sliding scales. So I always tell my my network, if they don't have Medicaid or whatever, to check out that as well, if you're needing therapy services. But yeah, thank you for having me. This has been great. Definitely would love a part 2 as well.
Thank you for participating. We certainly appreciate you, and we want to have the audience to we talk about loss, and Leah's dad and I were very, very good friends. I think about him all the time.
Mm-hmm.
Every time I go to Evansville now, I think about him. And sometimes she's recently suffered the loss of her dad. It's been less than a year. And sometimes we see people smiling, but we don't know what they're going through. So I
Mhm.
just want to let you know, it's good to know that people are concerned and people are praying for you. So I want you to know that we're praying for you. We love you and think about you guys and your mom all the time. So
Thank you. We need it, so
So-
appreciate it.
so you be yours. Christina,
I'm having a
closing
little
comment.
connection issues. I'm not sure if you can hear me, but I'm just gonna go for it. You guys are all frozen. But thank you for having me. I've enjoyed the PowerPoint, hearing the responses, the questions. I love talking about mental health. It's something that's never gonna go away, something that we can always improve. So I would just encourage people to educate themselves. It shouldn't be a stigma. We've gone through some times already, and we're probably going to go through more future times. So just really identifying what your healthy coping, your self-care mechanism, where it's working out or just cooking or just being around people you love. Tap into that and yeah, figure out what that is. And I've enjoyed my time here. Thank you. So we definitely have to do a part 2. I agree.
Very good. Thank you. Dr. Starr.
Well, I'm honored to be here tonight with Christina and Leah, that I love dearly, both of you, and I'm so proud of you and what you're doing to make a excuse me a difference in the lives of people. Dr. Anthony Walton, I also appreciate your work. You definitely have my prayers. As you touch lives and make a difference, the enemy will come at you. Your target when lives are being changed. So I'm going to be praying for you that God will continue to strengthen you and use you. And I'm also grateful for those that were on the line that shared this evening. Thank you for being with us. I'm glad to share the PowerPoint, and I pray and hope that it will be a blessing, continue to be a blessing. The copy is for Dr. Walton. If he chooses to share it with you, you certainly have my blessings. And I'm just grateful for what God is doing in my life. And I am very passionate about this. It's my calling as well as my profession. And I just count it an honor to be able to bring healing to so many people. And what a gift it is when you work with people who come to you broken, suicidal, who've given up, have no hope, and you can lift them up to God and say, God, you know what they need far better than I. And give me the wisdom, give me the knowledge, and take my skills and just use them to bring healing. And then to see God transform their lives. And you look at them 3, 4, 5 months later, and they don't even look like the same person.
Right.
They don't talk like the same person. And then you're sitting there just rejoicing, you and your client rejoicing over the wonderful transformation that has taken place. That's a gift. That's a gift that I don't take lightly. So I thank God every day I'm able to sit with someone broken and hurting and to see the power of God touch them. What a gift. So thank you for allowing me to be here to share, and continue to pray for me that I'll be even a greater blessing in the kingdom.
Amen. Very good. Thank you all. We want everyone, one of the things, as we said, please focus on your self-care. Please take care of yourself. Be mindful of yourself and be mindful of others. Reach out to someone else. If you think someone's going through something, you don't have to ask them, what are you going through? Just tell them, how are you doing? Tell them, I'm praying for you. Let someone else know what you think, because many times the devil will tell someone, no one cares about me. And so it's good for you. Just reach out to someone, just say, I'm thinking about you. Many times I'll text individuals, say, I'm praying for you. There are so many ways that we can reach out to people, and you don't have to be a therapist to tell someone, I'm thinking about you or praying for you. That's self-help in itself. There's so many little things that we can do. I want to challenge pastors on here. Please challenge some of the pastors we talked about. Start a health group, maybe once a month, a quarterly meeting where people who are dealing with grief or different issues, you can have. There's so many people who are willing to come in to help facilitate those groups. Start those groups in your church, and you'd be surprised. They need some people. There's so many groups that need to be met. Groups of divorced people, singles, battered women. There's so many groups that can be addressed, and so many issues that need to be addressed. And so we have to ask God to help us again. to deal with the holistic man. Listen, God bless you. Thank you for joining. Listen, for the next 2 weeks, we're going to be taking a break. This is the first time we have taken that extended break on Is My Turn Now. So we won't be back until about, I think it's the 13th of June. So get your questions, get your comments. Please share this broadcast. If there's a subject you want to talk about, please inbox me for about the next 2 weeks. I'm going to be somewhat of a vacation. So I know next week is a holiday, so I want you guys to enjoy yourself a holiday. Don't eat too much. All right. Enjoy yourself, but be safe. God bless you. Thank you once again for joining us. Be blessed. We love you and we appreciate you. Have a fantastic week. Again, enjoy the holiday.